Hello, I'm Christy Nelson, and welcome to this edition of 5 Talk Street. Heart disease is the #1 cause of death for both men and women in the United States. And here to give us some much needed information on what we can do to lower our risks are Dr. Srinivas Gudametla from Consultants in Cardiology and Jane Geis, the co-chair of the Dallas Go Red for Women Luncheon. Thanks to you both for joining us today.
Thank you.
All right, let's start with you, Jane. February is Heart Month. So what does that mean exactly? What should we be thinking about in February?
Heart Month is the month that we need to be taking a look at the #1 killer of Americans, and specifically with the Go Red movement, luncheon movement. It's when we focus on the #1 killer of women, heart disease.
So tell us about the luncheons. What happens during the luncheons and why are these so important?
Well, we have 3 luncheons, and we have one February 6th is Dallas, Denton is February 13th, and Tarrant County is the 20th. At these luncheons, it's actually a series of events and ends in a luncheon. We have screenings and programs and different educational events that our guests can take advantage of. And then the luncheon with speakers and more information, again, focusing on the #1 killer of women. And that's what the purpose of the luncheons are for.
Okay, and doctor, a lot of the focus on women. What's the difference between the risk for women and men?
Well, many of the risks are actually the same in men and women. It has been believed for many years that women's risk of heart disease was lower than men's. But actually, that's not true. We find out that women's risk is just as high as men. And in fact, for many years, the mortality from heart disease in women was actually higher than men. A lot of it was because of lack of suspicion, lack of awareness. A lot of it has to do with women's symptoms being different and not triggering an appropriate evaluation.
So what are the symptoms that women should be on the lookout for, and how are they different from the symptoms that men would experience?
That is one of the biggest challenges because women's symptoms tend to be very atypical at times. The classic symptoms of a heart attack is the crushing substernal chest pain, sometimes going to your left arm, neck, and jaw associated with trouble breathing, nausea, sweats, and so forth. And that's what's described in most textbooks. Women don't necessarily have those symptoms. A lot of times they present with trouble breathing, shortness of breath. A lot of times they just present with just kind of feeling blah, feeling very tired and having very little energy. And as you can imagine, that triggers other things that may be going on and not necessarily heart disease.
Okay, so a lot of this push is about prevention. So what are some tips that you have for prevention? What are the things you're stressing?
Well, I think it's important for women and men alike to know what their risk is. And it's important to do good lifestyle changes to minimize your risk. For instance, being active, exercising, weight control, watching your diet, making sure that you eat a good low-fat, low-cholesterol diet, knowing what your blood sugar is, knowing what your blood pressure is, and stopping smoking. I think if people do those things, that in and of itself is going to have the greatest impact in minimizing the risk of heart disease.
Okay, and we should point out, I think one of the stats that you guys brought with you, more than half of the people in Dallas-Fort Worth are considered overweight or obese. And it's a staggering statistic. Is that a major problem?
I think that is the biggest problem that we face in our society. In fact, over the past 10 years, we're able to decrease cardiovascular mortality by 20%. Unfortunately, because of the obesity epidemic, the likelihood that we'll have that same success in the next 10 years is less. And that is a problem that we have not only in this area, but the whole country alike. It's a very challenging situation.
Well, thanks to you both for coming in and talking about the risks and the Go Red for Women luncheons. And of course, all that information is on our website. And stay with us. We'll be right back with more of 5 Talk Street.